पेट भर गया मतलब बच्चे को न्यूट्रिशन मिल गया? No. This is one of the most common things we hear. But here's the catch. A child can eat plenty and still miss the nutrients that matter most in their growth. Because in the first 1000 days, food is not just filling the tummy. It's wiring the brain, building the body, shaping behavior. But what exactly is the first 1000 days? What does it actually mean for parents? Why is this window considered so critical that it cannot be made up later? Let's talk to Dr. Ajay Prakash, a pediatrician and a neonatologist from Tamil Nadu. Welcome, doctor. So, doctor, you mentioned that the first 1000 days in a child's life are very, very important. Now, we are not thinking about food from pregnancy onwards because this phase is pregnancy to the second birthday. We think of food in the now. So, can you tell us why this 1000-day period is so critical and so important?
Actually, these 1000 days periods are called critical period in nutrition.
Right.
So, from the day of conception till 2 years of age,
Right.
from what mother is eating till the 2 years of age is very crucial from the day of conception. During pregnancy, everyone will say the mother has to eat a more. It actually more about the quality, not the quantity. For example, mother should have a micronutrient dense food, folic acid, vitamin D, calcium. So the diet should be nutrient rich, not only the quality, the quantity.
Right, right. So these 1000 days from pregnancy to 2 years.
Yes.
So the child's eating patterns and what they're consuming is changing quite a bit through this entire phase. Can you tell us a little bit about that?
From the time of delivery till 6 months, the gold standard is mother's milk. From 6 months of age, the nutrient demands actually increases, which cannot be fulfilled by mother's milk.
Right.
That's where the home food comes in.
Right.
So that also should be like nutrient dense.
Right.
As I mentioned, for mother, the baby's food should be rich in iron, folic acid, and vitamins.
Yes, right. And what if this window has a few gaps? Say, for example, maybe a mother wasn't giving exactly or wasn't being provided a very, very nutrient rich or dense diet during pregnancy. Does that really affect the 1000 days? Or do you think that those gaps can be filled?
The gaps can be actually filled, but we cannot completely replicate the process. So as we have missed the most important things like brain growth. So as you mentioned, these critical days are responsible for the brain growth.
Right.
So 70% of the brain growth completed before the child turns 2.
Right.
So we cannot completely replicate, but we can compensate.
Okay. So I think this is a very important thing for parents to hear because the first 1000 days, like you're saying, it sets the foundation for the road ahead for a child's growth.
Exactly.
So doctor, when I was pregnant, I heard a bunch, right? I heard eat for 2, avoid papaya, drink milk every night. Now I want to know how much of this is science and how much of this is myth.
Actually, this is a very interesting question.
Right.
Most of the advice is eat this, eat that, avoid this, avoid that. Circulating in families are almost cultural, not clinical. Let me put it in this way. Exact calorie needed for the pregnant woman, that too in second and third trimester, is just 300 to 500 kilocalories.
Right.
Which is actually a one more balanced meal.
Okay.
Not double the size or double the portion.
Right. So what you're basically saying is this eat for 2 is a myth, but to eat nutrient-rich food, I guess, is what one has to look at.
To be medically said, there are like big 5s in pregnancies. As I mentioned earlier, the micronutrients. The first one is folic acid, which everyone knows. All the mothers are taking folic acid tablets during the first trimester, which is responsible for the baby's brain development as well as to prevent the neural tube defects in the brain.
Right.
And the second one is iron, which is again responsible for baby's blood production and the oxygenation of blood in the brain. And the third one is vitamin D and calcium, which is responsible for the baby's bone development.
Yes.
And the fourth one is like thyroid, iodine, which is responsible for the thyroid function. And the last one is omega-3 fatty acid and DHA, which is there in the fish and in the ghee. Right. So which is responsible for the baby's brain and eye development. So what matters most is the micronutrient in the mother's diet, not the portions.
Right. So that is to be looked at during the pregnancy trimesters. Interesting. So doctor, let's talk about the baby's first food, which is milk. Now, whether it is breastfeeding or it is formula based, I want to understand that basically there are so many opinions that circulate, right? Which is add honey, give water, drop night feeds. Now, how much of this is science, and like where should a parent stand with these kind of opinions?
For the first 6 months, breast milk is the gold standard.
Yes.
If breast milk is not available, the next safest substitute is formula.
Yeah.
So one of the most interesting fact about breast milk is it is a living fluid. It changes its composition every day, depends on the baby's needs and the baby's age. Breast milk contains 90% of water, whereas the formula is mixed with water.
Yes.
So there is no need of additional water, which has zero nutrients and is absolutely going to fill the baby's tummy, and there is no place for food to fill in.
This is 0 to 6 months.
6 months.
Okay.
Yes. And coming to Gripe Water, we all know which contains soda bicarbonate, which actually alters the baby's gut's pH.
Oh.
So overall, it collapses the gut-brain axis. And the third thing, honey, which contains a bacteria called Clostridium botulinum, which affects the baby's gut.
Oh.
So till 1 year, we cannot able to digest this bacteria. Whereas after 1 year, our gut is ready to remove the toxins from the gut.
Right.
So these three are totally unnecessary. And moreover, baby's kidney and gut are very immature to handle all these other things apart from milk.
I'm sure a lot of parents would really appreciate hearing this at whatever stage they're in at this point. Interesting. So, doctor, we hear this term HMOs. What does this mean?
The most fascinating part of HMO is they are not going to feed the baby directly. They pass the gut undigested and they are going to feed the good bacteria in the baby's gut.
Okay.
And this is responsible for improving the baby's gut immunity and to make sure whether the baby's gut can identify good bacteria or bad bacteria and reduces inflammation. And most importantly, the two serious infections like necrotizing enterocolitis and respiratory infections can be prevented by these HMOs. There are actually 200 HMOs in breast milk. So that's why we are saying it is irreplaceable.
So, doctor, another thing that parents worry about is protein. High protein, low protein, whey protein. It's all a little bit confusing. So, can you break that down for us?
So, mother's milk contains the right amount of protein for the baby's gut.
Okay.
But still the people are confused and thinking that they need extra protein, and they are like opting for cow's milk even in this 2026, even in urban settings. So which is actually not good, and it worsens the baby's gut.
Okay.
So cow's milk contains higher protein, but it is not suitable for the baby's gut. Whereas mother's milk contains less protein, which is like 0.9 gram per 100 ml, but
exactly what the baby needs.
Yeah, exactly what the babies need. And the whey casein ratio, as you mentioned, it is 70 to 30%.
Right.
Which is again suitable for baby's gut, and it is responsible for the proper amino acid profile that requires to build muscle and brain development for the baby, not the one from cow's milk.
So, doctor, what about night feeds? Should they be stopped? Because sometimes you'll hear people say that you should stop it so that the child knows how to manage their hunger and, it'll regulate sleep better, things like that. Because I've had too many sleepless nights. I've been doing a lot of night feeding, because my baby would wake up and, would require a night feed. So is that something that can happen, should happen? What is the science around that?
Yes, actually night feeding is not a habit to break.
Okay.
It is a physiological need of the baby.
Right.
So actually baby's gut is very small and it has very small capacity.
Yes.
So the baby's hunger keeps on coming even in the night.
Right.
So we cannot stop as such. So early few months of life, the baby needs nighttime feed as well.
Right.
So we should not follow the clock. We should follow the hunger cues of the baby.
Yeah. Your baby will tell you what you need to do.
Exactly.
The first 6 months, they bring so much excitement, of course, but a lot of confusion. Now, when the child is going to start eating their first foods, and sometimes, families will have traditions ki, acha, biscuits se shuru karte hain, or something, or like honey or whatever. Now, what should those first foods be? And if, for example, we have those first foods, if they go wrong, can we fill the gaps later?
There are two things actually happening after 6 months. The natural iron stores in the baby starts depleting. And other thing, the iron content from the milk is not enough to meet the baby's demands.
Right.
So we have to start a proper iron-rich complementary feeding,
right,
not as a replacement of milk, but that should be a top-up feed apart from the mother's milk.
Okay.
So coming to the other things like biscuits, cow's milk, again all this tradition comes up in every family. They always thought of asking the same question to me in the OPD. So when should I start the biscuit? So that baby gains weight. It happens. If the baby starts eating biscuits and cow's milk, they'll gain weight, they look healthy, but there will be a hidden nutritional deficiency. So ideally, these are the not good foods to start with.
So what are the good foods to start with?
That's a good question. So as I mentioned, iron-rich food. So
Right.
we should start with purees like carrot, beet purees, and pumpkin, spinach, and mashed dal. Apart from that, you can opt for fortified cereals as well.
Okay. Okay, doctor, another big debate question. Is cow's milk healthier than any other food that we make at home, like homemade food?
It's genuinely a harmful myth.
Oh,
So
okay.
every parent thinks the same way.
Right.
The baby doesn't eat anything, so go for a cup of milk. So actually, till 12 months of age, cow's milk is harmful to the baby.
Oh,
So
okay.
it irritates the gut lining
Right,
and it causes microbleed,
right,
so that the baby loses iron. So naturally, iron deficiency sets in for the baby.
right.
And the second thing, it has higher protein and mineral, so which is again overload to the baby's small kidneys.
Right.
So it will affect the kidney. And also it does not contain essential fatty acids and vitamins which are naturally available in breast milk as well as in the homemade food.
Oh, okay. So it's a big myth.
Yeah, obviously suggest to start cow's milk after 1 year of age, that too as a beverage, not as a replacement for the food.
Right,
So that should be like once or twice a day.
right. Doctor, by toddlerhood, a dinner table usually looks like a war zone because parents are panicking about weight and grandparents are saying, oh, I love the chubby cheeks. Now, I want to ask you this genuinely. A healthy looking child can still be iron deficient, right? So, doctor, why is iron deficiency such a topic of concern?
So as you said, not all healthy looking babies are actually healthy.
Yeah,
There is a nutrition deficiency, that too iron.
right.
So as an Indian, we know our household food are always like rice, wheat, and the milk. So which are all the poor sources of iron.
Right.
So, but it actually makes the babies chubby and healthy looking. That's why we mostly miss the iron deficiencies. And the actual symptoms usually we miss. Like the baby will be often getting cold or cough or fever, and their focus and concentration on the studies will be like decreasing. The sleep pattern will be altering. We commonly take this as a normal. As our child weight is good and height is good, we think this is normal part of development.
Right.
Actually, these are all the early signs of iron deficiencies.
Oh, okay.
So actually, when we worry is like when we see the reports like hemoglobin. When that is down, then only we'll be worried.
Correct.
Till the time we think our baby is healthy, he's good weight, good height, but that doesn't matter.
Okay. And other than the iron deficiency, what other nutrients should one actually look for? I know iron is an important one. Any others that one should really like focus on?
As far as our Indian food is concerned, iron and zinc deficiency is very common in our Indian kids.
Okay. So, doctor, other than the iron deficiency, what other do you notice in your practice are like nutrients that are a little bit deficient?
Yeah, coming to macronutrients, we are worried only about the amount of rice or the number of chapatis the kid eat,
Right.
not about the protein intake.
Yeah.
As far as our Indian household are taken, like for the breakfast, we usually go for either dosa, idli or chapati. There is a no proper balanced meal for the kid. Only the lunch contains the adequate amount of carb, protein and fat. So as far as the macronutrients are concerned, protein deficiency is very common. The child are chubby, but they are not muscular.
Okay.
Which is very important, which can be built from taking the adequate protein.
Right.
So which is actually missing in every Indian household.
Right.
Coming back to micronutrients, apart from iron, so there is a deficiency of zinc, which we usually miss and we usually don't care of.
Right.
So zinc is actually very good for the gut and the respiration. Like it improves the local immunity in the respiratory tract and in the GI tract, gastrointestinal tract, so that the baby will not get recurrent respiratory infections or recurrent diarrhea.
From zinc.
Zinc.
Okay. So some mothers continue to breastfeed even after a year, and some others will switch to different alternatives. So is there any right answer?
There is no right answer for this question.
Right.
Till 1 year, we can give mother's milk, but
Yeah.
World Health Organization recommends to give till 2 years of age.
Okay.
What I personally recommend is like till 1 year is fine.
Right.
Because after 1 year, what happens in most of the household, the baby started drinking more of mother's milk. If the baby is hungry, the baby will search for the mother, not for the food, for the
Right.
breast milk.
Right.
So if the baby is willing to take the right amount of food and taking like milk as a beverage, mother's milk for twice or thrice, it is fine.
Okay.
But if the baby is completely depending on the mother's feed, always searching for the mother, if the baby is hungry, then it is not fine.
Right.
So obviously the final answer should be given by a mother.
Right.
It completely depends on the mother. So what I personally believe is till 6 months, exclusive breastfeeding. 6 months to 1 year, breastfeeding plus proper diet. After 1 year, it depends on the baby and mother.
Right. So, doctor, a lot of new parents on Parent Talk, on Parent Tunes are asking the big question about microbiome. Now, what is this? What is prebiotics, probiotics, the gut health? I have zero information about this. So, please decode this a little bit for me.
Yes. Actually, the microbiome is the balance of good and bad bacteria in the baby's gut.
Right.
Which was actually decided in utero. There are multiple factors affecting these microbiome of the baby's gut, starting from the vaginal birth, which cannot be get from the C-section, and followed by mother's milk, so which contains the good probiotic and prebiotics, as you said. And coming to other thing, from 6 months onwards, the amount of food the baby is going to take, the amount of proper good food the baby is going to take, and coming to the treatment part. Whereas these days, like, parents are wanting more antibiotics to make the baby recover faster, which is actually not good. So whereas in my area, I am practicing in a rural area, people want the baby to recover as early as possible. The fever, they want the fever to go the next day.
Right.
If I'm not prescribing antibiotics, they will choose another doctor.
Right. Right.
So inappropriate use of antibiotics. So all these factors are responsible for this microbiome.
Right.
So which is actually directly connected to brain. So what we call these days, a baby's gut is the second brain.
Yes.
So which has more nerves than the spinal cord that connects to the brain from gut through a nerve called vagus nerve. So which is responsible for everything.
Got
so
it.
That's why everyone is worried about this gut-brain axis. So whatever you're putting in the gut, which is going to be responsible for how the child future is going to be.
Right.
Taking its child's cognition, writing, everything, child's intelligence. So everything depends on what you put inside.
So these antibiotics you mentioned, they can really affect the gut health of a child.
Exactly, because antibiotics doesn't know which is a good bacteria, which is a bad bacteria.
It just kills all bacteria.
It kills all the bacteria.
Right.
So our gut needs good bacteria for the digestion and absorption of nutrients to happen.
Got it. Doctor, what is baby-led weaning and is it safe? How do you compare it to spoon feeding? Like, what is your opinion on it?
Baby-led weaning is actually putting the baby on the separate high chair and making them eat on their own instead of spoon feeding, which is actually quite common in Western countries. But it is getting popular in India these days as well.
Okay.
So whereas what I personally suggest is combination of both. I would not suggest baby-led weaning as such, or I would not suggest traditional feed as such. It's a combination of both, because there is a risk of choking.
Yeah.
When coming to BLW. Whereas in traditional feeding, the baby will never try to eat on their own. So everything has
pros and cons.
Yeah. That's why I suggest the combination of both. For example, if we start purees at 6 months, we can feed them in the spoon. And then 7 to 8 months, mashed food. That also we can feed them in spoon. Coming to 9th and 10th month, where the baby can completely sit and take food and eat. They develop grasp.
Right.
So during that time, we can go for baby-led weaning, and baby knows to bite and chew. So that the
that
risk
hazard
of
is also
choking
less.
is less.
Makes
so
sense.
What I personally suggest is feeding style. And apart from that, the most important thing is the iron-rich food. So the style may be anything, feeding style may be anything, but the baby should get a proper
nutrients that is
iron-rich
required.
and nutrient-dense food.
Okay, so let us end with 5 truths that every parent should know. Number 1, early nutrition isn't just food, it's foundation. Number 2, milk matters, but timing matters too. Number 3, iron is the hero of the second half of the first year. Number 4, texture plus flavor is equal to confidence. And number 5, there's no perfect way, only the informed way. Thank you so much, doctor. You have really opened my eyes. I've learned a lot in this little conversation that we've had. Thank you so much.
Thank you so much.
Remember, you're not just feeding a tummy, you're shaping a lifelong relationship with food. Stay curious, stay patient, and enjoy the journey. Until next time, this is the Parent Lab on Parent Tune, where every question finds its science. Thanks.